Hello, I'm Dr. Jimmy Douglas, and while we look into the treatment of acid reflux or GERD, we have seen in our previous video that during acid reflux, the contents of the stomach are being flowed back into the esophagus, causing symptoms. So the aim of the treatment is, number one, we have to decrease the reflux, thereby reducing the symptoms. And number two, we are rendering the reflux harmless. And by rendering the reflux harmless, we are avoiding the complications. Mild intermittent symptoms. Majority of the patients fall into this category with less than 3 episodes per week, mostly in response to the precipitating factors. When you have on and off symptoms, lifestyle modification is advised along with over-the-counter anti-secretory agents and antacids. Antacids give a rapid relief, but the duration action is less than 2 hours. And the changes to be incorporated are weight reduction if overweight, sleep with head end elevated, not just the head, but the upper part of the body should be elevated. Don't lie down immediately after food. Be upright and walk for some time. Have your last meal of the day at least 3 hours before you sleep. Avoid the following, which relaxes the lower esophageal sphincter, leading to reflux. No smoking, no fried or fatty food, no tomatoes, no spicy food, no coffee, no chocolates, no mint, no citrus fruits, no large meals with fluids. Moderate cases. Moderate cases are patients having 3 or more episodes per week. Nocturnal awakening may happen due to regurgitation, or nocturnal choking can also happen. Drugs like H2 receptor antagonists or H2 blockers are used, which are cimetidine, nizatidine, famotidine, are prescribed for 6 to 12 weeks for symptomatic relief. Note that ranitidine is withdrawn by US FDA, and you can find the details in the link in the description below. And when these H2 blockers, which are available over the counter, are taken during an active heartburn, it acts in 30 minutes, provides relief for 8 hours from heartburn. If the patient is resistant to these drugs, or if there is no symptomatic relief, then proton pump inhibitors are used. These suppress the acid secretion in the stomach. Drugs like omeprazole, rabeprazole, pantoprazole, or esomeprazole are prescribed once a day for 8 weeks before breakfast. Approximately 10 to 20% of the patients do not get relief from once a day medications, so they are prescribed twice a day for 8 weeks, 30 minutes before breakfast and dinner. So the aim is to stop the acid, which has a pH of 1 to 2, from causing mucosal injury. It is important to maintain the intragastric pH between 4 or more than 4 to reduce the mucosal injury. And by keeping the intragastric pH 4 or more than 4 for more than 18 hours per day, then the mucosal injury can be healed. And proton pump inhibitors are the drugs of choice in acid suppression in gastroesophageal reflux disease. Severe cases. For patients with typical symptoms who are not responding to medications, atypical or extraesophageal symptoms like asthma, or who are being considered for anti-reflux surgery, combined esophageal pH impedance testing is done. In resistant and complicated cases not responding to medication, surgery is advised, which is called as laparoscopic fundoplication, wherein gastric fundus is wrapped around the esophagus, which increases the lower esophageal sphincter pressure. Now let's go to the common questions which are asked on this topic. Is ginger good for acid reflux? No medical data suggests that it is good for acid reflux, but it is used for alleviating the symptoms of nausea and vomiting. Can GERD cause breathing problems? Yes, it may cause breathing problems when the reflux enters the lung. It may cause pulmonary aspiration and asthma, leading to breathing difficulties. How often does GERD lead to esophageal cancer? Malignancy is uncommon in the United States with 7,000 cases per year. And the duration of acid in contact with the lower esophagus is also important. If the duration of acid in contact with the lower esophagus is longer, then squamous cells in the lower esophagus turn into metaplastic columnar cells, leading to a condition called as Barrett's esophagus. And Barrett's esophagus is found in 15% of patients with chronic reflux. Having Barrett's esophagus increases the risk 11-fold for cell-sewing dysplasia, which might lead to cancer. Can GERD cause weight loss? We have seen in GERD that it is causing dysphagia, that is difficulty in swallowing. So the patient might not receive proper nutrition, thereby leading to weight loss. Thank you for watching, and see you in the next video.